Okay, good afternoon, everybody. I'm Peter Zanoni, Corpus Christi City Manager, and we're going to begin our joint City of Corpus Christi, Nueces County COVID-19 press briefing. We've been doing these Monday through Friday now for I think about 9 weeks or so. It's been a while, but today's Friday, so this will be the last one of the week. And what we've done over the past 6 weeks is on Friday we've had our Texas A&M University at Corpus Christi team present some analysis and trending and modeling, and they're here today. So the majority of our conference will be dedicated to them. Dr. Bird will be presenting a 6th iteration of their analysis today that is updated, obviously, with new numbers and new modeling and that type of thing. So it will be myself who will speak first. I'm going to talk a little bit about our numbers, and also on behalf of Judge Barbara Canales, I'll talk about some of the National Guard testing sites that are scheduled for this weekend. And then I'm going to just do, what I'm going to do also is a summary of what Dr. Bird is going to present, so we can start thinking about what he's going to talk about. And then as he's presenting, you'll see it, but I just wanted to highlight so we know ahead of time what he'll be talking about. And so right after me, Annette Rodriguez, our Public Health Director, and we'll talk a little bit about just some of the testing stuff that she's doing, and a look ahead to next week's testing. Okay, so that's kind of an overview of what we're going to cover. So let me get into the numbers for us here this afternoon. And every day at 4 o'clock, we take a look back at the past 24 hours to see the change in number of confirmed cases and the change in the cases that we do have, the status of the person as to whether or not people are recovering or are there more people in the hospital and so on. So since yesterday at 4, we are reporting an additional 22 cases for Nueces County. And so you can see in our graph, we've had a kind of a consistent higher number of cases per day for Nueces County. The black lettering's a little hard to see, but 15 on, I guess, what was this? On Sunday, was that 11th on the Sunday? Or Monday? Monday. We had 15, 27 on Tuesday, 12 on Wednesday, 23 on Thursday, and then 22 today. And so that brings our total caseload since we've been counting this to 231. That's total cases. The active cases, though, that we have out there, that is persons that have not recovered, is 140. And I'll show you more on that. So 88 people of that 231 have recovered, but 140 are still active. There are still 3 deaths in Nueces County, no change there, so 2 from the city of Corpus Christi and 1 from Robstown. With today's 22 new cases, there are 12 persons that are male and 10 are female, and the distribution's a little bit more towards the male. 133 of all our cases have been male, and 98 have been or are female. Okay, and then every day we kind of talk to the community about the distribution of by age group. We have 9 different age categories that we place the cases based obviously on the person's age. The key takeaway for today is of the 22, we had a big number in the 40 to 49-year-old age group, so 5 additional persons there. But probably bigger news is that in the 60 to 90-plus-year-old category, 1, 2, 3, 4 age brackets, there were a total of 9 persons. So not quite half, but a good majority were in the older age category. The last couple of days, actually this week, they've been in that younger category, younger age category. So 1 in the 60 to 69-year-old group, 3 in the 70 to 79, 4 in the 80 to 89 age group, and then 1, and this is the first time we've had a count in this group, in the 90-plus-year-old group. There's a new confirmed case, and that would be our first that we've had in that age bracket. The number of tests continue, and today the city's lab didn't do too many, but we did have some tests through the National Guard, so 144 tests through the National Guard and the city's labs, and 113 were reported to us from hospitals, clinics, and physicians. So we did 257 tests in our community today. And the total tests performed since we've been tracking this is 5,751. And yesterday, it was around 1.5% of our population, so it's probably a little bit higher. I didn't calculate exactly today, but we've tested about over 1.5% of Nueces County's total population. Okay, so let's look at our donut here, and this shows, it's a little bit hard to see, but the darker blue are the active cases, 140 active cases. And then the recovered cases is in the lighter blue, this one here. So those are the recovered cases. That number's 88, and then the active cases is 140. And so 38% of all the cases are recovered. So about a little over 60 are still in that non-recovered case. A little bit of change in the hospital status. We had one person, we had 6 in the hospital as of yesterday. Today we have 5. And also yesterday we had 2 in ICU, intensive care. Today we have 1. So there was a drop in each of those categories. And the recovered rate, yesterday it was 80, and today it's 88. So 8 additional persons have recovered since yesterday. And then the community is interested as to where did the cases come from? We in Nueces County have obviously the city of Corpus Christi, but we have about 7 other townships, smaller cities. And so the 22 today all came from the city of Corpus Christi. That brings us up to 208 of all the cases. Robstown, Port Aransas, Nueces, Port Aransas, rural Nueces County, Agua Dulce, Bishop, and Driscoll all have cases. The only place in Nueces County is Petronalia. They still have 0. So, okay, now we're going to look at 2 graphs here. This shows our 7-day trending, and we've been using these recently to show not just, it does show 1 day at a time. On this one here is test performed. That's the blue bars. But if you look at a 7-day average running total, right, if you look back the last 7 days and see what is the average test for average testing done in over a 7-day period and call it one number, our average on test, which is the red line, the 7-day running total is 252. So you can see our tests are still continuing to go up, probably from around 420 or so. You can begin to see a pretty nice upward climb in tests performed. And then our next chart that we've created recently shows the cases of positive persons, and this one really kind of shows what's going on this week. I mean, you can see that earlier bar chart where there were pretty significant numbers each day of the week. This one shows you kind of a daily, you can kind of see by day, but what it's showing us is the 7-day average. So it's not a daily count like I was showing you in that other one where there was a bar. This shows the 7-day average of number of positives. And so what you can see today is over here at almost 15, we're at 14.7 or 15 cases on average every day when you look at a 7-day running total, right? So those that have been watching out there for a while, remember that at one point we were down to a very low averaging way down here. It was less than 1 case per day. Right now we're kind of the other extreme, which is 15 cases for our 7-day running total average. And Dr. Bird from Corpus Christi A&M will help to explain some of this, but you all have seen it, and you know what we've been talking about this week, people that have been watching. Okay, so let's see. I don't know if did you want to translate that part? Okay, Gabby will translate that part, and then I'm going to do an update on testing for the weekend, where people can get testing, because we're still doing, and I do need to make clear that yesterday we did talk about a slight deviation of our resources in terms of focusing this coming week on daycare, senior centers, and we only have so much material. It's not really the labor or the time of day, it's that we only have so much testing material, either the swabs or the material that you take to analyze the test. And so we want to use our resources that we have for the senior facilities that we're going to be targeting to be testing. And so because of that, right now for early next week, we don't have a drive-through test scheduled drive-through test site scheduled. But what I'm going to talk to you after the Spanish translation is that the National Guard is doing testing in 2 different areas on Sunday and Tuesday. And so the message is there's still plenty of testing places to go. And those 2 in particular are accessible and free. And so I'll talk to you about those right after the Spanish translation.
Las cifras más recientes indican que en las últimas 24 horas se han reportado 22 casos confirmados por el virus, haciendo un total de 231 casos. 133 son hombres, 98 son mujeres. La mayoría se encuentran en el rango de edades entre 40 y 49 años. A la fecha se han llevado a cabo 5.748 pruebas por el virus entre el Distrito de Salud Pública y laboratorios privados. De los 231 casos, 208 son residentes de la ciudad de Corpus Christi. También hay residentes en Robstown, Port Aransas, Driscoll, Bishop y Agua Dulce. 88 de los 231 casos se han recuperado por completo, haciendo así un 38% de casos. 5 personas continúan en el hospital, 1 en condición crítica en la unidad de cuidados intensivos. 140 casos continúan aún activos y se reporta hasta la fecha 3 fallecimientos.
Okay, great. Thank you, Gabby. Okay, so let's talk about testing. So the National Guard, as we know, has been throughout the state of Texas, but they've been in Nueces County through the last week or so. And there's 2 testing locations. One is this Sunday, the other one is Tuesday. We're going to put the information up for the Sunday one right here. And so these National Guard testing sites have there's 2 different groups of people that can go to get tested here at these locations. And for both of those groups, testing is voluntary, it's free of charge, and it does not require a person to have symptoms or to be living with an employee, in one case, of our beef processing plant who has tested positive. You don't have to show symptoms or live with an employee, or even an employee who has been in contact with an employee and who has tested positive. These are some of the things that you do or don't need to have to get the testing. So basically, the testing is pretty much free for persons that have worked at STX Beef or are a family member of XTS Beef. Also, if you're not, but you're showing symptoms of COVID-19, you can get the testing free as well. Okay, so if you're an employee of STX or a family member, you're not exhibiting signs, you get free testing. And if you're not that type of person, but you're showing signs, then you can get free testing through the National Guard. Okay, so the one Sunday is Sunday, May 17, 9 a.m. to 5 p.m. That location is at the Richard Borchard Fairgrounds, and that's at 1213 Terry Shamsi Boulevard in Robstown, Texas, so 9 to 5. And then Tuesday in Port Aransas, Tuesday, May 19, the same time from 9 to 5. That'll be at City Hall, Port Aransas City Hall. That's Tuesday, 9 to 5 on the 19th. And now the next slide for either of those events, it's the Sunday one or the Tuesday one. And these events are for 2 people again. Remember, STX employees or STX family members, or the general public that has symptoms of COVID-19. If that occurs, if those fit your category, you're going to use this email address or call this number to get pre-registered for the testing event. And so that number to call is 512-883-2400. And then the website is texascovidtest.org. So TXCOVIDTEST.org. You can email to set up the appointment and take care of other business that you'd otherwise take care of over the phone. Okay, so those are the 2, that's the 2 requirements to get that free testing. And those are the numbers to call in the 2 locations, so Sunday and Tuesday. Those testing locations through the National Guard have been very popular. And they're similar to our drive-through site. It's quick, and they've been testing a lot of folks. So take advantage of that if you fit those categories. And if you have questions, call that number, the 512-883-2400. Okay, now just I'm going to do a quick thank you to a couple of groups, and then I'm going to do a quick summary of Dr. Bird's presentation, and then we'll have Annette Rodriguez come up and just talk a little bit about testing, and then we'll turn the rest of the program over to Dr. Bird of Texas A&M Corpus Christi. Okay, so through these over 2 months worth of work, we've had a lot of volunteerism through the community and persons investing time or money, but we've also had a lot of people take care of some of our employees. Our employees and a lot of our operations are working tirelessly around the clock, missing meals sometimes. So we want to thank Dr. Katie Sanchez from Houston, Texas, who donated lunch today to our health staff. She's an oncologist, and out of the kindness of her heart, she donated meals for the health district staff today, and we want to thank Dr. Katie Sanchez for doing so. So thank you, Katie. And then we also want to thank several individuals from the Coastal Bend Cancer Center. That's here in the city of Corpus Christi, and they donated over 100 specimen collection kits to the health department today. There's several doctors here, and I'm probably going to not get their names articulated exactly right, but Dr. Saloom, Dr. Let's see, Manilow, Dr. Manilow, Dr. Villamil, and then Dr. Segal were the doctors from that center, so the Coastal Bend Cancer Center. We want to thank them for donating those over 100 specimen collection kits to our health district, which is going to help us out a lot. That means we can test over 100 people. Otherwise, we probably wouldn't be able to because of our supply shortage. Okay, and then finally, I'm going to just give you a quick primer of what Dr. Bird's going to talk about so you can begin to think about what this presentation will consist of today. And then after this, Annette will come up just for a few minutes, and then we're going to turn it over to Dr. Bird. So this will give you a quick primer of what's coming. We meet with Dr. Bird and Dr. Tussaud and their team a couple of times a week to go over what they're working on and then get ready for today's presentation. So some of the takeaways that you're going to hear from him and some that you just saw from me is that our numbers of new cases in the Coastal Bend are rising, right? And that's not a good thing. The outbreaks in our city, at least, in the city of Corpus Christi from our beef processing plant, as well as some of our transitional housing facilities, or one of our transitional housing facilities are causing some of the high case numbers. But it's not just because of those two events or two places. COVID-19 is spreading in South Texas, and our transmission rate has gone up. It was below 1.0 at one point. Now it's up to 1.4, and Dr. Bird will explain what that is if this is the first time you're watching. So our transmission rate is up. One good thing, though, is our hospitals presently are well within capacity, so that's been a worry across the world, and our hospitals presently have plenty of capacity, so that's good. We're not worried about beds or ventilators or that type of thing. It is one thing that Dr. Bird's going to do a good job pointing out, and we want to thank local business leaders, to include those at STX Beef here in Corpus Christi, but it is critically important to identify and to contain outbreaks. I think Dr. Bird's going to use some examples across Texas where businesses did not do that, and that's where you really have a high number of cases. And so we have been praising South Texas beef all week, and certainly deserves to mention it again that having great business leaders at that meat processing plant where you do quick intervention and you care about the employee and you care about the community, that has big results on spread. And so it's critically important to identify when you have an issue and to contain it. And it protects the workers, but it protects the community as well and the business. So also another thing, and this is important to think about, there's two ingredients that can cause the spread of COVID-19. And it can cause it pretty quickly or slowly, depending on these two ingredients. So ingredient number one is the number of infected people, right? If you have a large number of infected people, that can cause COVID to spread. But something else to consider is the rate of transmission also can have even a more devastating impact or positive impact on the spread. And the rate of transmission means how many new people are affected by somebody that has COVID. And so if somebody has COVID-19, what the health professionals have been saying is you isolate and you stay away from the general population. But this week alone, we know some folks haven't done that in Corpus Christi, as evidenced by some of our police officers being in quarantine right now. And so the rate of transmission means how many new people are infected by someone with the COVID. We want to keep that number low, and that happens both ways. So if somebody has COVID and you have a face mask on, you may not get the virus, right? So the transmission rate is impacted not only by those that have it, but others that don't, and how they behave as individuals by either wearing face masks, by social distancing, by not going out, by minimizing interaction with people. So those are two things that he's going to talk to us about. Okay, and I think that's it. There's a few other highlights, but those are some of the ones to kind of consider as you begin to think about Dr. Bird's presentation. Okay, great. So Gabby's going to translate some of that, and then we're going to have Annette come up and talk to us about testing for the week, and then we'll turn it over to Dr. Bird. Also with Dr. Bird is Dr. Tussaud from Texas A&M today, so we want to thank him for being here as well.
Durante los últimos 2 meses hemos contado con numerosos voluntarios y empleados que nos han ayudado de muchas maneras. Algunos de ellos nos han brindado comidas o artículos necesarios para realizar pruebas para detectar el virus. Muchos de ellos son doctores locales, así que le queremos agradecer. Tenemos información de las fechas en donde se va a llevar a cabo la toma de especímenes para 2 grupos en particular. El primer grupo es para personas que viven en la misma residencia que un empleado de la planta South Texas Beef. El segundo grupo es para personas del público en general que presenten síntomas por el virus. Solamente se va a realizar la toma de especímenes en las personas que tengan cita. El primer día es este domingo en el Centro de Exhibición Richard Borchardt, ubicado en el 1213 de Terry Shamsi Boulevard en la ciudad de Robestown. Ese día es el domingo, mayo 17, de las 9 de la mañana a las 5 de la tarde. La segunda fecha es el día martes, 19 de mayo, en el Ayuntamiento de Port Aransas. Le recordamos que tiene que llamar al 512-883-2400.
Thank you. Annette Rodriguez, Health Director. So COVID-19 testing continues in our community at various locations, as City Manager Zanoni mentioned. If you are experiencing symptoms of COVID-19, please call the mobile testing teams at 512-883-2400, or you can look on the website at texascovidtest.org. This coming Monday, May 18th, other businesses such as gyms and exercise facilities, manufacturers, and other retail offices reopen at limited capacity. There are minimum standard health protocols that are established by the Office of the Governor for businesses who can reopen. Please adhere to these protocols for employers, employees, facilities, and for the patrons. Follow the social distancing guidelines and other posted guidelines when using facilities or visiting offices. Continue to wear your mask, especially when you're in areas where you cannot social distance or social distancing becomes challenging, and definitely in areas of high traffic. Another prevention tool that the CDC recommends is wearing gloves. For the general public, CDC recommends that you wear gloves when you are cleaning or caring for someone who is ill. In most situations, like running errands, wearing gloves is not necessary. Instead, practice everyday precautions like social distancing, washing your hands with soap and water for at least 20 seconds, and wearing face coverings when you must go out in public. For the patrons of gyms, the governor's protocols recommends wearing gloves that cover your wrist when using exercise equipment. Make sure that you clean off the exercise equipment and disinfect it as well when you are done. As this weekend begins, let's all do our part to practice the public health strategies. Continue to stay at home as much as possible. Avoid crowds and large gatherings. Avoid people who are sick, and if you are sick, stay home until fully recovered. Cover your cough and sneezes. Do not touch your eyes, nose, and mouth with unwashed hands. Your actions and the behavior you practice can make a difference. Stay safe, stay healthy, and as always, stay informed. Thank you.
Las pruebas para detectar el coronavirus continúan llevándose a cabo en la comunidad en varios lugares. Si tienes síntomas, llama a los equipos de la unidad de pruebas móviles al 512-883-2400 o a la línea directa del Coastal Bend Wellness Foundation al 361-353-9572 para hacer una cita. El próximo lunes 18 de mayo, negocios como gimnasios e instalaciones de ejercicio, fabricantes y otras oficinas minoristas reabrirán a capacidad limitada. Hay protocolos de salud estándar mínimos establecidos por la oficina del gobernador para las empresas que pueden volver a abrir. Siga estos protocolos para empleadores, empleados, instalaciones y clientes. Siga las pautas de distanciamiento social y otras pautas publicadas cuando use las instalaciones o visite las oficinas. Siga utilizando su cubrebocas, especialmente cuando se encuentre en áreas donde el distanciamiento social puede ser difícil y en áreas de mucho tráfico. Los Centros de Control de Enfermedades también recomiendan la utilización de guantes desechables, especialmente cuando esté limpiando o cuidando a una persona enferma, aunque no necesariamente cuando vaya de compras. Quienes vayan a ir a un gimnasio, los protocolos del gobernador recomiendan usar guantes que cubran su muñeca cuando use equipo de ejercicio. Limpie y desinfecte el equipo cuando haya terminado. Seguimos recomendando que se quede en casa tanto como sea posible, evite las multitudes y reuniones, así como las personas enfermas. Y si está enfermo, quédese en su casa hasta que esté completamente recuperado.
Good evening, everybody. My name is Dr. Chris Bird. I'm here to present this week's review from the TAMU-CC COVID-19 Modeling Task Force. It's been an eventful week, I think, for everybody involved with the COVID-19 response, and for us also scrambling to determine how to explain what's happening to everybody and how to interpret it. So I want to begin by reminding everybody of the task force objectives, and the first are to address public concerns and questions about COVID-19 and the interventions that are being taken to mitigate the effects of COVID-19 in the Coastal Bend area, and two, to enable evidence-based decision-making by our leaders and you as the audience, as well as our business leaders in the areas, something I became aware of this week. The report is for the 12-county Coastal Bend area, not just Nueces, so there will be some discrepancies between the numbers that Manager Zanoni presented versus the numbers that I'm presenting, and also my numbers are generally from yesterday, so they won't be updated with the last hour's information. So we're going to start this week a little bit different than the past few weeks, discussing what an outbreak is. And this is something that I did myself this week because I was positive somebody was going to ask me that, and Manager Zanoni did ask me that earlier today. And so an outbreak, it's a rapid rise of occurrence in disease. It can also be used for other situations, but COVID-19 around the world, it's a pandemic, but it's also considered an outbreak. But we can also have localized outbreaks where something happens that's out of the ordinary, and there's a cluster or a smaller area of that's experienced a rapid rise in disease. I think that to understand outbreaks, it's very important to understand the transmission rate of the virus. And this is something I've been talking about week after week. And I remember in week one, I was discouraged heavily from talking about the transmission rate because it's maybe hard for people to relate to. But in the end, almost everything about this virus and how it works is related to the transmission rate. And everything we're doing is to try to control that transmission rate. And so in this infographic that I lifted from CNN.com with the link down here at the bottom of the screen, it shows a transmission rate of 2. For every one person that gets infected, they further infect 2 additional people. And you can see very quickly it expands to a lot more people getting infected in a very short period of time. This number of 2 is too high. And we're trying to control the transmission rate so that it's lower. But in an outbreak scenario right now, a transmission rate of 2 or higher could be occurring on a localized area. Also realize that the number of people that are infected have a direct impact on how many people are infected in the next generation. So here's one generation, the next, there's 4, then there's 8, then there's 16. So it's increasing exponentially each generation. And so the more people there are that are infected at a given transmission rate, the more people that they're going to infect. And so these are 2 things that we're really interested in trying to control. Up to this point, really especially up to Easter, we had a very favorable number of people infected in the Coastal Bend area. And since that point forward, the numbers have been steadily rising. And those numbers rising, it's like embers that are around. And if there's little stacks of hay to catch on fire, those would be people that unfortunately aren't able to social distance properly and they haven't built up an immunity to COVID-19, then those embers can catch. And the more embers there are, the more the haystacks that are out there can catch. So one thing is we want to eliminate those haystacks. We want to keep down the number of embers. So we have 2 localized COVID-19 outbreaks that have occurred in the past week and a half, or at least that we've become aware of in the past week and a half in the Coastal Bend area. And I think that it's really important to really commend these establishments for complying and rapidly testing not just a few of their employees that were sick, but everybody in the terms of the transitional facility, all of the people that were housed there, as well as all of the employees. And in terms of the meatpacking plant, all of the employees in the meatpacking plant are being tested. And I think it's also important to commend the employees themselves and the frontline workers that are there helping to make this happen. This is a huge increase in the amount of testing that's happening in our Coastal Bend area. And I think that it should inspire some bit of confidence that we were able to flex to this higher level of testing. So the action to remedy should be encouraged. We shouldn't be discouraging businesses from remedying when there might be a problem. And they should be commended for the actions that have been taken. And an undergraduate sent me a message this week and said, hey, Dr. Bird, you should take a look at this news story from the Panhandle of Texas. And it was about another meatpacking plant there. And in late April, they had 121 cases of COVID-19 associated with that meatpacking plant. Well, that meatpacking plant didn't agree to test all of their employees. And now the latest articles I read just a day or two ago said that there's over 300 people that are infected now from that same meatpacking plant. And they're now finally going to test all the employees. So comparing that to what we've done here in the Coastal Bend, I think it shows that we've responded more rapidly, and this kind of rapid response is what's going to be necessary to contain these outbreaks. So we're going to talk about how outbreaks start and how we stop them. I'm going to start with an outbreak starts in the first place in a location where there's potentially a higher transmission rate than in other places in the Coastal Bend area. So the blue box here represents the whole Coastal Bend area, and the orange box represents a hypothetical portion of the Coastal Bend that has a higher transmission rate for one reason or another. So at this point in time, at the beginning, there's more people infected in the Coastal Bend than there are inside of that potential outbreak area. But this is like one of those haystacks that could catch on fire. And so the virus enters the outbreak area from the community. So if there was no COVID-19 in the community, then this wouldn't turn into an outbreak. And if there wasn't a higher transmission rate within the confines of the smaller area within the county, then there wouldn't be an outbreak either. So these two things have to go hand in hand. So this higher transmission rate within the outbreak area leads to once COVID-19 gets in there, it gets transmitted more rapidly to more people. The transmission rates can be much higher than what they are in the general population, and this can lead to a very rapid increase in the number of cases in a short period of time. So once that occurs, the people don't generally stay within that area of higher transmission. They go there, they transmit or contract the disease, and then they go somewhere else. In their daily lives, they're going to get groceries, they go home. And this is when that outbreak starts increasing the number of people that are infected in the Coastal Bend area as a whole. I think it's important to point out that this infectious period is from the point at which you start showing symptoms to maybe 2 days before that until the point when you self-isolate. That's a period of time when if you were associated with an outbreak, you might be spreading the virus. And then that starts to spread to other people. Now that rate of spread outside of the outbreak area, it's not as high, but there's more people that have it, so we're still seeing an elevated number of cases. So overall, the numbers I've been able to glean thus far from our two outbreaks, between 8% and 49% of the people involved have tested positive for COVID-19. And we can compare that against the Coastal Bend area as a whole. And what we're comparing against is people in the Coastal Bend that got sick, went to their doctor, got tested, and then got confirmed positive for COVID-19. That's 1.1% of those people that qualified to get tested because they had symptoms that might be consistent with COVID-19. So you can see this big discrepancy, and that's showing the difference between the transmission rate in the different areas. So that probability of transmission in the coastal bend, I just want to emphasize one more time, it's not higher, it's still low. There's just more people that are transmitting it. So the rate at which they're transmitting when they leave the transitional housing facility or the meatpacking plant, it's lower than it was inside of there. But there's more people that are moving around that have COVID-19 that can transmit it. So that's the dynamic that we've been seeing. So what you want to do is stop that from happening, because otherwise the outbreak could potentially trigger other outbreaks. So it's very important to contain the outbreak. And so you can see between the last slide and this slide, what I've done is I had a dashed line around the outbreak area, and now this is representing that's contained. The way that you contain the outbreak is by diagnosing. You need to test everybody in the area or connected with the facility that may have an outbreak occurring. So that starts with comprehensive testing, which we've done. Secondly, contain. For those that have COVID-19, it's very important to self-isolate and don't go out in public when you have it until 14 days after you were diagnosed, and that should be enough time generally so that you're not infectious anymore. Contact tracing can help to identify how far there's been spread from the outbreak area to people outside of the outbreak area. And so I know that those things are happening right now to try to track down anybody else who may have contracted COVID-19 in that area. So this is how we try to contain the outbreak and prevent it from triggering other outbreaks, or just generally raising the probability that there might be another outbreak downstream. To end the outbreak, the key thing is to diagnose what was happening within the outbreak area in order to reduce the transmission rate. The transmission rate is something that we do have control over. Now, the virus has some control over it in the ways that it remains on our hands and on our faces and on everything that we touch, and the way it's contracted through droplets in the air. But we can affect that by wearing masks to stop that transmission, washing our hands, social distancing. If we're policymakers, it's putting policies in place so that your employees don't end up increasing their chances of transmitting, and also encouraging employees to realize that COVID-19 doesn't stop at the door and doesn't stop at the break room or outside at the break spot for smoking. COVID-19 goes everywhere with you. And if there's a loophole in your social distancing policy, you need to find it before COVID-19 does. And that's the main thing. I know I myself, I manage a laboratory with some employees, and we've put policies into place, but I'm learning new things every week that, I should have been doing this, I should have been doing that. So I don't think there's any shame in if this ends up happening to you. I think the key thing is to identify it and get help and rectify that situation to prevent things from getting worse. So once you remedy and extinguish and adjust your policies, you could go to a situation where the transmission rate within your place of business is actually lower than it is at average outside of the confines of the building, or at least hopefully at the same level as. And so this was just one example, and it could get very complicated with every building in Corpus Christi and every workplace that's out there. But our goal is to try to keep these outbreaks down to zero, or preferably not a lot of different businesses having them happen at the same time. So with that, we're going to move forward with showing some of the more detailed look at the cases. And as we know that there's a fair proportion of the cases in the past week that have been from testing of employees of the meatpacking plant or of the transitional housing facility, or of people that lived at the transitional housing facility. I direct you right here. What we're looking at is the cumulative number of cases through time. So this is our running total. And when you see it bending like this, it means we were leveling off. And so we were leveling off at one point. And that leveling off stopped right around Easter. After Easter, we started to increase. And that's when you see this curving upwards, curving away from level. That is showing that we're having an increasing rate in the number of cases. I think everybody realizes that right now, just based upon the numbers that we're seeing. Like Manager Zanoni said, it was not more than 3 or 4 weeks ago that there was a whole week of zeros and ones, and now we had several days in the double digits, which is something that we want to try to avoid moving forward. And the question now becomes, is this a blip? Do we identify this outbreak or these 2 outbreaks, contain them, and we all learn our lessons from it and adjust our social distancing policies, and we kind of go back to the trend we were on at the very least, which was not increasing as fast as we are, or maybe we could even get it to the point where we're not increasing, or at least increasing at a very slow rate. So it's something to consider. Within the Nueces area, this data might be a little old right now, but this was, for comparison, the number of confirmed cases. I have the star here because this data was 1 day newer than the 236 cases for the Coastal Bend area. Overall in the Coastal Bend, 114 recoveries versus the 236 total cases from the beginning of the pandemic. In our comparison to San Antonio, I want to remind everybody that we do the comparison to San Antonio because of, I think, the strong connection that we have here in the Coastal Bend to San Antonio and the strong connection they have with us. We like to go shopping there. They like to come to our beaches. And it's something you can look at to see how are we faring. And even though our number of cases are going up, our total number of cases are still lower than we're seeing in Bexar County, which is the most populous county in San Antonio. And this is on a per capita basis. So certainly there's more people in San Antonio, so these numbers would get even more distant if we were to put in the total number of people. The difference now is 2.5x. Last week it was 3x. So we're getting closer to Bexar County, and that's something that we kind of don't want to happen. So hopefully this is a wake-up call for all of us here in the Coastal Bend. And if that wasn't, I think this could be the wake-up call, which is that on a day-by-day basis per capita, we're now seeing more cases in the Coastal Bend than are occurring in San Antonio. So the rate of new cases that we're accruing right now per 100,000 people in the Coastal Bend area, given these localized outbreaks that have occurred, they've pushed us higher. Now, hopefully this is a blip and we're going to come back down. But we can't completely tell the future of what's going to happen, and these outbreaks are sort of an X factor that's hard to account for as we're opening up businesses in different areas in the Coastal Bend area.
Say, Dr. Bird, can you go back to that prior slide and just go over that one more time?
Sure.
Yeah, tell us what was Bexar County's and our number, the 2.5.
Okay, so there's 2.5 times more cases per capita in Bexar County right now than there are in the Coastal Bend area, and this is the cumulative total number of cases per 100,000 people. So what we're doing is trying to put on an even playing field the comparison of how high is our rate of infection, or what proportion of our population has been infected versus Bexar County. And so down here, you can see this curved up a little bit. So here it was 3x. We were at 3x pretty consistently, and now it's curved up to down, if you will, to 2.5x as we've curved up with these outbreaks. Now, if these double-digit numbers of confirmed cases subside, then this would kind of level back off, and we might go back eventually to something closer to 3x, but we would stay at 2.5x for a while if we just trend in the same way that they do. And then this, one more time, this is the rate of new cases per day. So the points on the graph, that's the number of new cases day by day. The data is very noisy, so we fit these smoothers to the data. So you can see in Bexar County, San Antonio, we've had this process of going up and down in terms of the rates of new cases per day. And we have also had one up, one down, and now we're on a sustained up that had started after Easter, essentially, and has accelerated with the localized outbreaks that are hitting our data right now. One thing that I want to point out is why I'm saying a blip is that if a large proportion of our positives are associated with the outbreaks, and we've contained the outbreaks, then we expect that we might go back to lower numbers of new cases per day. And so that's why we're going to have to wait and see what happens. This is a view just of the Coastal Bend area where we're comparing Nueces County and the orange line in terms of the number of new cases per day to the rest of the Coastal Bend area. And with this scale now, with the outbreak numbers coming in, and realize one of the reasons why these numbers are really high is there was a higher proportion of people testing positive than in the general population, but also because extensive comprehensive testing was getting done. So it's a different sampling of people that are in those points. And there still are the background level of people that are going through the normal channels of getting sick, and their doctor recommends that they get tested. And so these two values are added together right now. And it's something that we're working on teasing apart, but we couldn't quite have that happen for today. That being said, we were on this upward trajectory already. It just accelerated in the past week, as I think is pretty obvious just by looking at the numbers of cases. One thing that I don't think is very obvious from this graph that I want to point out, and I've been watching this for over a week now, is San Patricio County since May 1st has had a steady increase in the number of cases for COVID-19. And you can see here it's approximately a linear trend that's increasing. We're looking at the whole Coastal Bend area, and one of the graphs that I look at looks at all the counties separately. And San Patricio started behaving differently, maybe as early as the first few cases we were able to start to detect that. Thus far, I've been able to connect 4 of these 15 cases to one of the local outbreaks, and it remains to be seen if there are more than just those 4. Ideally, it would be all 15 of the cases were tied to the local outbreaks, but if it's not, this might be an indicator that something else is happening in San Patricio that's not connected, and that's something that we want to try to figure out moving forward as we process the testing data that's coming in. So with that being said, that's our review of the basic case count data for this week as it stands. And I think it's also important to review the cell phone metrics. Again, I show this slide because in 2008, it was considered very controversial to look at everybody's cell phones by Batman in order to get the Joker and save the day. And now it's commonplace for all of us to click, yeah, sure, have access to my GPS on my cell phone so that I can use your great app for free. And what ends up happening is people track where you go. Businesses want to sell you things. And this data is out there and it's sold, and some of it is available to us for free. And so what we want to do is use that data to our advantage for good, like Batman did, and use it to try to figure out what's going to happen in the future. Now, the reason why the cell phone data can be indicative of what's going to happen in the future is that we're using the cell phone data to get an idea of how many new infections are occurring. And the way that we're doing that is looking at this encounter index. And the way the encounter index works is each one of these points is a day. The height of it represents how close to normal. So normal is defined as 100 on the line. That was the average encounter index, normalized encounter index before March 9th. And we chose March 9th because generally that was the first day of spring break at TAMU-CC. It was 2 days before the NBA canceled its games. And it was basically when everybody started to realize that COVID-19 was here and people started changing their behavior, as you can see in the graph. Each one of these points is estimating on average how many potential contacts are occurring between people, and it's scaled to what's normal for Nueces. So at 100, that would be the normal number of contacts that were occurring between people, as defined by 2 cell phones that come within 50 meters of each other for less than 60 minutes, and then a statistical algorithm is used to calculate the probability that they'll actually come in contact. The longer period of time, that 60 minutes, those phones are near each other, the higher probability of them coming in contact. This is not the be-all, end-all perfect metric, but it's one of the only ones out there that actually tries to measure exactly what is connected to the transmission ratio, which is contacts between people. And I think you can imagine that some of the other metrics like distance traveled, while informative, you could travel a long way and not really come in contact with anybody. Another thing that I'll point out is that things like driving in your car are automatically removed from this data set. So what we saw was a decline. By the time of the stay-at-home, we were already at a very low encounter density as predicted by the cell phone data. And when you come in contact with somebody, you might contract the virus. And then you have 5 days between when you contract the virus on average and when you become symptomatic. And then once you become symptomatic, most of us don't get a sniffle and then go to the doctor, although that should start to be the way that it is now. We might wait a day or two to see if it's really something substantial. Then the doctor will recommend that we get a test. It might take a little bit more time to get that test and a little bit more time to get the test back. So that's why this is almost like looking into the future, because as the encounter index increases, as it's doing over here in the most recent times, we expect that about 7 to 14 days in the future, we'd start seeing the positive cases coming in from the contractions of COVID-19 that occurred previously. So the important thing to note is that this is the first time this has happened since March 9th. On Saturday, we were well above 100. So what this means is that the encounter index in Corpus Christi was at normal levels as we've defined it here. And if we were all in bubbles on Saturday, then transmission wouldn't occur and the encounter index wouldn't mean anything. But we're not in perfect bubbles. Even if we're wearing a mask, there's still some ways that we could contract the virus. And if we're not wearing a mask and not social distancing, there's even more ways that we can contract the virus. And the more encounters we have, there's a linear relationship between the number of people you come in contact with and the probability that you contract COVID-19. And so this is high, and it seems that outside of the outbreak, we predict from the cell phone data that we're going to see an increase in the number of cases in the Coastal Bend area, just as that background rate. So that 1.1% that I talked about early on, we expect that might be increasing. So here, I didn't point that out. Here we're focusing on the weekend. That's Friday and Saturday. Friday and Saturday are generally the busiest days of the week in terms of this index. And this past was the highest, and that's why we're saying there was a weekend spike in these encounters. Now, there is another way to look at this data. This is the same data, just visualized in a different way. And this is called a candlestick plot. If you have stocks, you may have looked at some one time or another at your stock portfolio and seen a graph that might look something like this with red bars and green bars. And what it shows you, is I think it shows you something a little bit closer, because back here it's kind of hard to tell what's going on over here. It's just a bunch of points, right? But when you show it like this, you can see that from April 27th forward, we had a steady increase in the encounter density index all the way to Saturday. And then from Sunday to Tuesday, which is the last data point on the graph right now, we had a steady decrease. And so that may be one potential silver lining here, is that we're seeing this decrease. That does coincide somewhat with news stories on the outbreaks that were occurring in the area. And it hopefully, in my mind, maybe some of the realization that COVID-19 is real has led to people potentially decreasing their possibility of contracting COVID-19. So hopefully that's what we're seeing here. So green means a decline, and green is good, unlike your stock portfolio. Red means an increase, and in this case, red is bad. So it's the opposite of the way your stocks work. One thing that I think that I want to show is the alignment between this type of data and our case count data. And it doesn't align perfectly, but this is how it works, and this is what the lag looks like. So the blue is our encounter index superimposed on our case count smoothing data. This case count smoothing data is from last week, and the reason why I'm showing that is because it's just easier to see the curve without the line shooting up so high that this starts to look flat. But what you can see is that we had a dip in the encounter index, or the low point, in this period, and then about 7 to 14 days in the future from the end of this dip, we see the end of the dip in our smoother line fit to the case count data in the coastal Bend area. So this is one reason why we feel like this data does tell us something about what's happening. This week, a graduate student at Texas A&M University, Corpus Christi, calculated that between 30 to 40% of the change in that orange line could be associated with the change in the blue line. The week before, I talked about, I had looked at that about 25 to 30% of the change in that orange line could be associated with increased number of tests. And then the ultimate question is, where's the rest of the percentage there, right? So maybe we have 30 and 30%, that's 60%, maybe 70%. There's a lot of other factors that are affecting transmission rate besides just cell phone encounters and how much we're testing. And so that's kind of everything else. The fact that we could explain a fairly good portion of it, at least right now, with this index and just the number of tests is pretty encouraging. Although one thing that I've learned for sure is that as time moves forward, this gets more and more complex. And I don't know how long we'll be able to use it for, but at least right now it seems to work. And there's that time lag you can see from the trough in the encounters with the cell phones to the trough in the cases. And so this decline is mirroring the decline over there and mirroring our social distancing and everything that we're doing to mitigate the transmission of COVID-19. And if anything, I think this shows that we have some bit of control over this. And what we're trying to learn now is how can we control it while not locking ourselves inside of our houses at the same time. And it's difficult, and we're all new at this. And it's something that we're going to figure out. So with that, I want to review the interventions that were in place. First, we had a mandatory stay-at-home order, but now we're encouraged to stay at home if we can. If you have a job that lets you telecommute like I do, then you should stay at home. And I try to stay at home as much as I can if I'm not mowing my lawn or walking my dog. And for myself, I get curbside. If you can get the curbside, get the curbside. Why go inside the store if you don't have to? Truthfully, I think it's extremely convenient, and I hope that it continues for the rest of my life, that I don't have to go into the store. Second, there's a loosening of restrictions on social and public gatherings, and this has been kind of a staged thing, and there's a variety of things that are lumped into here. The stay-at-home is kind of a staged rollback, but also going on with this are public gatherings at the beach. I've noticed some parties when I drive through there to see what's happening in my neighborhood. We just had Mother's Day. I noticed that there were some parties and gatherings in my neighborhood that certainly weren't happening previously. And so this loosening of restrictions has led to more public gatherings, which decreases our effectiveness at reducing the rate of transmission. The things that are still in place, school closures, social distancing. So this is us being mandated to social distance and being asked to wear masks, be hygienic and wash your hands, and be cognizant of trying to not transmit potentially COVID-19. The way that I treat it is I treat it like I have it, and I don't want to infect anybody else, and I don't want to get infected either. And then self-isolate when symptomatic, very critical, especially during these small flare-up and outbreak scenarios that we're seeing right now. That will help to keep it contained. So those interventions are a preview, and they're being done to control this high transmission rate if there were no interventions. This week's estimate of the transmission rate for South Texas, which is from Corpus Christi over to Laredo and to the south to the border at the Rio Grande, is about 2.8 people infected per person that was initially infected. So what this means is that if you're starting with one person that's infected, from week 1 to week 2, you have 3 people that are infected. And then those 3 people infect an additional 8 people. And those 8 people infect an additional 24 people. And those 24 people infect an additional 67 people. For a total overall of 103 people infected from that 1 up to 103 in 1 month. So this can happen very rapidly. And this high transmission rate is one of the reasons why it's very difficult to contain COVID-19 and coronavirus. And it makes it different than a lot of other viruses that we've faced in the past. So we're doing the interventions to try to reduce this number. Our estimate right now of the background transmission rate in Texas, so in South Texas, so this is the transmission rate in the coastal bend as well as Laredo and down to the southern areas of Texas, is about 1.4. So that looks a lot better than the previous graph, but it still eventually becomes high. It still leads to exponential growth in the future. And this is why we want to keep the number of people that have COVID-19 down so that we can keep the number of people that are getting infected generation after generation, so that's week after week here, lower. So the difference between 103 and 12 infected in 1 month from the interventions that are in place. And that's our best estimate of it. Now, a new figure that I'm going to show, which is based upon the previous figure, is our estimates of the transmission ratio across the whole kind of pandemic outbreak time. It was initially quite high in South Texas, and this is averaged over all of South Texas, and it's parameterized by the number of fatalities. We don't have enough fatalities, thank God, in the coastal bend area to be able to parameterize this model, so that's why we moved to South Texas. Now, the problem is we now have enough fatalities in South Texas to be able to parameterize the model, when before we were using all of Texas. So during the stay-at-home period, we're estimated to be below 1. And you see these are straight lines for the whole time. The estimate is the same. It's averaging over that whole time period what our effectiveness at social distancing and controlling the transmission rate was. When you're below 1, that means dying out. That's no longer happening, but that downward curve that we saw earlier in the number of cases, that was during this time when we were below 1. And it inspires some bit of confidence that the model predicted we were below 1 and our cases went down at the same time. So there's congruence there. Now what the model predicts, and this model is blind to the cell phone data right now. It's just looking at the interventions that are taken. So on May 1st, we've transitioned to this average now of 1.4. And this will change week over week as our behavior changes and it's averaging over that whole time of the intervention. One thing that we're going to do is we're working on getting cell phone data integrated into this so there can be a more day-by-day change in our estimate of it. But for right now, this is a very advanced and complex statistical model. I know it doesn't look like it, but it's the strongest model that we have pretty much. And it's modified from Imperial College and has been vetted in open source community. So that gives you an idea of where we were and where we are. So the point that I like to end with is, and the presentation is showing some of the projections from an epidemiological model. And we talk about some scenarios. So we're going to keep the 3 scenario format that we've had in the past couple of weeks, but there's some changes this week. And we're going to a transmission rate driven scenario. So all 3 scenarios are going to be open Texas on May 1st, but the difference is going to be the transmission rates that are occurring. So we get a transmission rate of 2.0 if we just completely remove stay-at-home and completely allow public gatherings. Hooks are playing, conventions going on in the ABC Center, restaurants full, but all the other interventions are kept in place. That looks like a 2.0 right now in the model. Then we parameterized a second open Texas by reducing the transmission rate from May 1st forward to 1.4, which is the estimate of that Imperial College model of what our transmission rate is in South Texas. And then the third scenario is a very low transmission rate, but above 1, so a very slow increase, just to see kind of the extremes. And I could have made this 1.0, but it becomes pretty obvious that the 1.1 is even too low for what we're at. So I thought that was pretty good. And based upon my reading of the cell phone data, maybe before the end of the stay-at-home, we may have been around in a 1.1 sort of area. So it's assuming that 1.1 goes forward. Now, this is parameterized off of Easter. We start changing the behavior of people at Easter based upon the cell phone data, and then we let the interventions kick in or phase out on May 1st to go to these 3 different transmission rates. And we're going to go in reverse order. We're going to start at green. And so this is what the projection looks like for the number of infectious people that have yet to social distance in the community on a day-by-day basis. Here's our initial increase and decrease. I know that some people in our group have said, well, Chris, these numbers look too low. It only goes up to 100. But the thing is that this is over time. It's only the people that are infectious in that period of time, which can only be a small window of time from day 5 to our estimated generation time in the model is 7.5 days based upon 2 different estimates from the literature. So 2.5 days of potential spread, and in that 2.5 day window, these are the number of people that are in that window day by day. And when we look at something like the cumulative number of cases, it makes a lot of sense. This is about 4 to 10 times higher than the cumulative number of cases when we look at that. Or if we look at the number of new cases, that's about 5 times higher. So there is some alignment there. And what you see here essentially is a slow increase. And by the time we get out to a month from now, which is about when the projection ends, we're approaching about where we were at our high point. And that's not great, but that would be a lot better than the trajectory that we're on right now, which is higher than that. So there's a slow increase, and maybe we could work on getting that down to even. But this is the model parameterized off of the 1.4, which is the best estimate of the rate of transmission in the coastal bend area right now. One more time, what that means is that on average, you can't get 1.4 people sick if you have COVID-19. You can only get 1 or 2. But if we went to, say, 3 people, then we could get about 5 people from those 3 people getting sick. And so that transmission ratio of 1.4 means you're more likely to get only 1 person sick than 2 people sick, but some people get 2 people sick. And it starts off not too bad, but within only a couple of weeks, we reach the same level we were at our peak back in early April, according to this, and then we're continuing to go up. And I want to emphasize that this does not take into account any changes in behavior that might occur if we actually do start going up this curve. And certainly the way that the data looks right now, the case data with the outbreak inflating our numbers above the background, these kind of align closely right now, but we expect, or we're hoping, that doesn't continue as the blip from the outbreaks goes away. So the third projection is if everything just went back to normal on May 1st. We know that didn't happen, but this is, the models are important to show you the range of possibilities and what would have happened or what could have happened if certain things had been done differently. And one thing that you notice is the ribbon is a lot narrower, so there's a lot more certainty that we'd be going up, is what this says, and we'd be going up really rapidly. In a very short period of time, we've already have eclipsed this point, and it's really outside of what we're actually seeing in the data right now, what this projection is. So we can know that we're not here right now. We're somewhere around here, according to the outbreak inflated numbers we're seeing right now, but hopefully it's even more between the green and the blue. The width of the ribbon is there to show the uncertainty and parameters that we have, and there's a fair amount of uncertainty moving forward. But this shows that basically we expect increases. The cell phone data shows that we expect increases. And the one thing that says we might expect some decreases in our number of new cases per day is that hopefully these outbreaks subside and there won't be another outbreak. So going beyond this, I think it's important to go and see what would happen with our hospitals in this extreme scenario of just everything went back to normal on May 1st with a transmission rate of 2. And Something that I asked for today was how many people were hospitalized in the past 24 hours, or maybe the previous 24 hours, due to COVID-19. So there were 21 patients admitted, and then presumably based upon Manager Zanoni's numbers earlier, that somewhere around 16 or 17 of them were also discharged. That's a good sign. But if you look at this graph, we're somewhere around here right now, and I know the scale is pretty big for up to 100, but the upper end of the graph would show something around the 20s right now, and the lower end of the graph would be closer to the 5 patients that we've seen day after day be occupying the local hospitals. Now again, we don't see a lot of support for this model in the number of cases, and so this one is closer to our transmission ratio, and at least for the foreseeable future, it predicts that we'll be below hospital capacity, which on average is estimated to be somewhere around 360 patients, but that's something that we're working closely with the local hospitals, and they assure me that they can flex upwards to accommodate more, and it's built into the system. So again, if you compare this 21, it would be at the upper end of the blue ribbon right now. But what the blue ribbon is projecting is people that are in the hospital day after day versus people that were discharged after just a short time of the same day in the hospital. So for right now, it looks like the hospital burden is manageable and should be for the foreseeable future. So this brings us to our summary of everything that we've talked about. I know this was a little long, but there's been a lot to talk about this week that we weren't initiated on in our discussions with you out there in the audience in the past several weeks that we had to cover. So take-home messages: 1, new cases in the coastal bend are rising. I think everybody realizes this. The outbreaks, the localized outbreaks, are responsible for at least the high case numbers that I saw through Wednesday that were in the data. Hopefully that continues. 2, COVID-19 is spreading in South Texas. Our estimate is that the transmission rate is 1.4 people infected for every other person that gets infected. The evidence that's pointing towards this spreading and increasing numbers of cases are not just increasing numbers of cases, but increases in the rate of the number of cases. Cell phone data, fatalities, epidemiological models, percent positive cases, all these things are pointing in that direction. And the proportion of cases, or the fact that we're testing more, doesn't explain everything that's out there. All these different things combined with the outbreaks are combining for these larger numbers that we're seeing. The hospitals are presently well within capacity, but this is something that we're tracking closely, and we have direct communication on the task force with healthcare professionals in the local hospitals, and they're the first ones to find out if we see something, and they tell us if they see something on the front lines that's occurring, so we can help as much as we can with that. Secondly, it's critically important to identify and contain these smaller flare-ups and localized outbreaks, 2 of which that we've become aware of in the past week and a half. This involves businesses, leaders, essential frontline workers, everybody. All the workers that are in these facilities, the people living in these facilities. It's important to commend them for complying and for coming forward and helping to contain this outbreak. And this comprehensive testing that's been done by the National Guard and by our local officials and everybody has been excellent and much more timely than I saw at least in one other meat plant in Texas. And so hopefully this means that we're going to get control of this. There's lessons here for managers. I'm one of these people where I have people that work for me and I'm in charge of setting up policies within my laboratory, even if there's people above me that set more general policies. The governor sets very general policies, and then each of us below, as you go down the totem pole, can work within the guidelines of those policies to try to close loopholes. If you don't identify the loopholes in your social distancing policies, COVID-19 can. I think that's an important message to realize. Just because you don't test doesn't mean that people don't end up in the hospital and don't get sick and don't show up for work after that time. So it's not good for business to have people contracting COVID-19. Having a strong policy to prevent transmission within the workplace is important. Lastly, not lastly, but 3 of 3, there's 2 ingredients for the spread of COVID-19 that I've talked about. Manager Zanoni prefaced today's talk with that. I just want to re-emphasize there's 2 things happening here. Transmission rate, which can be viewed also as the probability that you contract COVID-19 as you have encounter after encounter with other people, or the probability that you transmit to 1 person, 2 people, hopefully not more than that, if you have COVID-19. The other thing is how many infectious people are out there. You could have a transmission rate just above 1, but if there's 10,000 people that are infectious, that could turn into a lot of additional people contracting COVID-19. And so these 2 things work in unison. With these local outbreaks, right now, there hasn't been an effect a real effect on the rate of transmission in the coastal bend. But what there has been an effect on is the number of infectious people. And so that's the thing that we need to consider. So outbreaks overall, they do result from a highly localized increase in both the rate of transmission and the number of infections. And that's what you're trying to mitigate with your social distancing policies in the workplace. They do result in more infectious people in the rest of the coastal bend area, as long as people are leaving the place where the outbreak is occurring and going to other places. Outbreaks do not, at least right now, as long as they're isolated outbreaks, they do not result in increased transmission rate in the rest of the coastal bend if they're contained. However, if they're not contained and we keep increasing the number of people that are infectious in the community, then more and more of the loopholes in our social distancing policies will be exploited by COVID-19. It will turn from it was an isolated incident to now our overall transmission rate is higher, because it's the average of the transmission rates everywhere we go. Every house we go to, every business we go to, it's the average of all those that makes up that 1.4. And it's higher and lower in different places. And the last thing I think is important to say is that we have a lot of control. And it's not just our managers, it's not just our bosses, it's not just the governor or the judge or the mayor. They certainly have their roles to play. And I think that they're doing it, but we also have our role to play as people that could transmit COVID-19. And one of them is that we should really wear masks in public. I'll ask you this: do you wear a seatbelt? If you wear a seatbelt, then you should probably wear a mask, because the same concept is going on there. You wear a seatbelt, 1, to protect yourself, right? You're wearing a seatbelt to protect yourself, just in case you get in an accident, that you don't get severely injured. The reason why it's a law is because the medical costs associated with people getting into accidents that don't wear seatbelts are so high that it burdens the rest of us. So it's become a law because it's impinging on everybody else. With wearing a mask, it's very similar. You can protect yourself, and at the same time, instead of monetarily, you're also actually preventing or metaphorically decreasing the rate of other people getting into an accident by putting on your seatbelt or your mask, if you will. So wearing masks in public is very important. There's a lot of different styles of masks. You can wear masks based on your alma mater, which I saw earlier today in the room. You can wear American flag masks, which I saw being worn by the guards when I came in to the building here. My neighbor has a cheetah mask. Or if you're a boring scientist like me, you just wear the one that you had already with your normal surgical mask. But no matter what kind of mask you wear, it's very important to help try to keep us open in Texas. Secondly, self-isolate when symptomatic. Once you have the slightest inclination that you're sick, you need to self-isolate. For the managers that are out there, you want to accommodate this, because the first loophole in your social distancing policy is having people come in that might have COVID-19. If you can prevent that from happening, you can prevent a lot of other loopholes that might be there in the system. Stay at home if you can. If you have a job that allows you to stay at home, stay at home. If you want to go for a car ride, as long as you don't go for a car ride and then get out go to a party, then that's not going to result in increased transmission. So there are ways and things you can do you can get you out of the house and keep you from going stir crazy at the same time as staying safe. And you can postpone social gatherings or have them online. This has been something that's been happening in my family and my significant other's family. Is we know people, somebody in our family has Zoom, and then they set up a Zoom meeting, and there was a birthday party yesterday for my mother-in-law, and I talk with my mother on the weekends with my other sisters, and it's really, we talk more now than we ever did before. So it might be improving our relationships, or my relationships with my sisters at the very least. So these are things that we can do. Things that we want to support, more testing capacity. The National Guard has kicked in and helped out here. We're getting new machines that can handle more samples. Being able to have that high testing capacity that enables us to contact trace, test as many people as possible for free, as I heard Manager Zanoni announce. That's critical to helping identify self-isolate of infectious people. And I left off some of the other things because they're kind of outside of our control, and these are really the things that we can do ourselves to help things here in the Coastal Bend area. So with that, I'd like to thank everybody on the task force, everybody that I'm not mentioning by name, everybody that helped to form the task force, and everybody that helps me figure out how to communicate to all the audience that's out there today the things that I have to say. Because maybe I'm not the best communicator normally, but after Manager Zanoni is done with my presentation and giving me feedback, I think it gets a lot better, and I'm better able to reach all of you. So thank you.
We'll see if the media has any questions for Dr. Bird. You guys have any questions? Okay, Seth, go ahead.
That was like a full lecture.
I feel like I'm back in college. All right, Dr. Bird, if you take away the outbreak cases, are the end of stay-at-home and phase 1 of Reopen Texas to blame for our rise in daily cases?
I think that the way you phrased the question is framing it in a way that I don't think is accurate. Certainly, ending stay-at-home has decreased the effectiveness of reducing transmission rate. Every time we're going into a business, every time we go into work, that's a possibility for transmission to occur. But that's not the only things that are contributing to this. If we could stay at home, but we don't, then that could be something that's contributing to this. If we choose to have a party because it's Mother's Day and Mother's Day is very important, that can contribute to things. And so there's a lot of different things in place. Also, I didn't emphasize it this week, but previously I did emphasize that about halfway through the stay-at-home, our encounter index started increasing. And that's just from us getting cabin fever and having a hard time staying cooped up. Some people have small houses, some people live in apartments with a lot of children that it becomes extremely difficult. And so there's a lot of difficult situations that people are facing right now. So all these different things combined are affecting what's happening. And I think that part of what's going into this is, we want to see what we can get away with. How much can we get away with in our normal everyday lives and not have things get worse? Or what are the risks that we're willing to take in order to continue on and be able to make money, or be able to go to work? I think that those are some of the things that are contributing. It's a huge open-ended question. There's a lot of different things that contribute to it.
And of course, phase 2 starts Monday. Do you anticipate any kind of impact from even more businesses reopening?
Well, it depends on what we do. Ultimately, there's probably going to be some sort of effect of people being concerned right now with these numbers going up so fast and so high. But I mean, inevitably, more contacts without appropriate precautions can lead to more transmissions. And so it's really important to have a very strong social distancing policy in place and get the highest quality mask you can if you're in a very high-risk scenario. The more people you come in contact with in your work or in your everyday life, the more PPE you should be using to try to mitigate that. I did read an article a couple weeks ago about a restaurant in Dallas where one of the workers said that the manager said that if they wanted to wear a mask, they could leave. That is probably not the best way to help control the transmission rate as a manager. And you have to think about how many people won't show up if that's the way that you run your business versus how many people will. So I think there's a lot of different dynamics playing out right now, and inevitably we don't like being told what to do as people. I'm no different. And sometimes we have to learn for ourselves, sometimes the hard way, of what is going to work and what won't, and what's an acceptable risk, and what are the consequences of the things we're doing.
Thank you.
Okay, great. Thanks, Dr. Bird. That was a great presentation, and there was a lot of good comments from our viewers on Facebook today, praising the work, Dr. Bird, of the presentation, the facts, and really giving some great dialogue. So we appreciate those watching on Facebook and on YouTube. We're appreciative of the channels that are here. Chris Six is here, KIII is generally here, and thank you, Caller Times, for being here as well. And I believe this concludes our press conference today. So over the weekend, there won't be any scheduled press conferences, but we'll be back on Monday with our press conferences. And over the weekend, we will update our statistics around 4:30, 5 o'clock on Saturday and Sunday. On our website is our dashboard. You can see it on your cell phone as well. We formatted it so you can easily see it on your cell phone as well if you don't have access to a computer. So were there any other general questions, I guess, from the media? Okay, great. All right, well, have a safe weekend, everybody. We'll see you all back here on Monday. Thank you.